Next, I want to invite to the stage the group from Occupational Therapy. Come on to the stage. On that note, shout out to Marcos, Luke, CG, Calvin, everyone from Communications and Marketing, running the photography and video for us today. I really appreciate your work today. All right, welcome.
Good afternoon, everyone. My name is Alisa, and I worked on this project with Taylor, Madeline, and Gabrielle. We're in the Occupational Therapy program. So good afternoon, and thank you all for being here. We are thrilled to share the research that we've been working on for the past 2 years with Dr. Nuwere and Dr. Seminger, who's our collaborator from the University of North Dakota. We had the honor of presenting this project at both the AOTA and ISOTA conferences this year, and we were very passionate about our work, and so we're excited to share it with you. So the title of our project is A Critical Analysis of Race, Gender, and Disability Representation in Occupational Therapy Textbooks. So our research stems from a broad issue seen across healthcare education, and that's that many textbooks in fields like medicine, nursing, and allied health have historically lacked meaningful representations of race, gender, and disability. That gap highlights the need to critically examine our own profession and determine whether or not occupational therapy textbooks reflect the diverse populations that we serve in practice. So OT textbooks often serve as students' first formal exposures to many foundational aspects of OT, such as different health conditions, therapeutic approaches, client populations, and professional values. Textbooks are generally trusted and authoritative educational tools, and they play a critical role in shaping how future practitioners understand care, build empathy, and develop cultural competence. When marginalized groups are portrayed in stereotypical ways, or if they're excluded altogether, these materials risk reinforcing biases that can persist into clinical practice. So now for our literature review. Studies have supported that textbooks can strongly influence how students understand clinical roles, patient populations, and standards of care. This in turn shapes their early professional identity and clinical decision-making. A study by Kalantari et al. Conceptualized a hidden curriculum, which is basically the unspoken lessons that students absorb from repeated exposure to biased content in educational resources. These implicit messages can reinforce stereotypes and shape students' attitudes towards clients, even if not directly taught. So when we take a closer look at the actual content of textbooks across discipline, we find narrow portrayals of race, gender, and disability. For gender representation, Deckman et al. Found that men in healthcare education materials were frequently depicted in active leadership roles, whereas women were often shown in passive or relational roles. A similar study found that in medical textbook imagery, women were shown in emotional or non-clinical contexts and were rarely shown in decision-making roles. So in terms of disability, Mosley and Gibson examined children's rehab textbooks and found that disability was consistently framed from a deficit-based perspective, often portrayed as needing to be fixed. Literature review shows that portrayals of individuals with disability tend to emphasize their limitations rather than highlighting their independence or participation in everyday life. Lastly, for racial representation, Pusey-Reed et al. Found that racial minorities are often underrepresented or misrepresented in nursing textbooks. And this pattern is also seen in other studies where most textbook figures are white, with minorities often depicted in stereotypical or limited roles, such as only appearing as patients. Louis and Wilkes found that light skin tone was overrepresented in 3 out of the 4 medical textbooks that they examined, and there was no imagery of people of color or dark skin tones for 6 common cancers in these chapters of the textbooks. Our proposed methodology, content analysis, was supported by many studies that found success in analyzing textbook images to quantify diversity and identify gaps in representation. So with this support, we move forward with our methods. We wanted to see if similar trends exist in occupational therapy textbooks, so we raised the following research question. To what extent are race, gender, and disability represented in primary textbooks in occupational therapy education?
So to address our research question, we conducted an image analysis of the 4 most widely used OT textbooks that we selected based on the NBCOT's 2020 Curriculum Textbook and Journal Report. These textbooks were referenced in NBCOT, which is the National Board for Certification in OT Exam Development, as they represent core entry-level content and knowledge. The total sample consisted of 1,148 images, which contained 2,429 individuals. We conducted an image analysis to descriptively analyze race, gender, age, disability, and provider status. Here you could see the textbooks that we analyzed, including a pediatric and mental health textbook. To develop the data spreadsheet and organize the images, we assigned each image a unique ID based on the textbook and page number. Each rater was randomly assigned to a group of images, and demographic characteristics were analyzed using visual cues. We recorded the number of individuals in each image, if faces were visible, and characteristics such as race, which we defined as BIPOC, standing for Black, Indigenous, and other persons of color, gender, age, disability, and provider status. We also noted the image type and category and any additional notes. The inclusion criteria for the images included those with realistic human depictions, whether a photo, drawing, or diagram. We excluded images without realistic skin tone and no human features. Unclear images were categorized as undetermined, and we used a group consensus for these subjective cases if visual cues were insufficient due to factors such as lighting, angle, and image quality. So moving on to our results, we identified the distribution of the 5 demographic characteristics and found that across the 4 textbooks, there were significant disparities in diverse representation of individuals in images. So here, this graph shows BIPOC representation broken down by each textbook. The yellow represents non-BIPOC individuals, while the black and white lines on the bottom show BIPOC representation. Overall, across all textbooks, 81.47% of individuals were classified as non-BIPOC. Next, this graph shows the representation of age across each textbook. Overall, 64.31% of individuals were adults, shown in yellow, with very little representation of older adults and pediatric populations, with the exception of the K. Smith or OK textbook, which is a pediatric textbook. These graphs show the distribution of male and female individuals in each textbook, with the dark gray at the top being undetermined for unclear images or images without faces. Overall, 55.21% of individuals were female, shown in yellow, so there was generally more female representation in the textbooks, but not as significant of a disparity compared to the other characteristics that we analyzed. These graphs show the distribution of providers, represented by the black and white lines, and non-providers in yellow. Across all textbooks, there was limited portrayal of individuals in the provider role, with 82.17% of individuals shown in the non-provider role. And then here, these graphs show the representation of individuals with an observable disability or mobility impairment. The yellow represents non-disabled individuals, and the black and white lines represent individuals with observable disabilities. Overall, 79.25% of individuals across all textbooks had no observable disability or mobility impairment. Finally, across all demographic categories and textbooks, 24.13% of individuals were classified as undetermined due to unclear images or lack of faces shown.
Now that we've shared our overall findings, it's important to highlight how we ensured consistency in our data. Since we were coding subjective visual characteristics like age, race, gender, provider status, and disability status, it was essential to confirm that different reviewers were applying the criteria consistently and objectively. This image represents our inter-rater reliability scores, which reflects how well different raters agreed when coding the same set of images. As mentioned earlier, the images were initially divided amongst 5 trained reviewers and then reassigned so that each of the 424 selected images were rated by 3 people. This process resulted in 1,272 individual ratings, which we used to calculate inter-rater reliability. To assess the reliability and consistency of these ratings, we used the interclass correlation coefficient, also known as the ICC scores. The results showed excellent inter-rater reliability. On a scale of 0 to 1, our overall ICC was 0.904, indicating strong agreement amongst raters. The most consistently rated categories were age, race, and gender, each with an ICC score above 0.90, suggesting that these characteristics were the easiest to classify based on visible features. In contrast, provider status and disability status showed more variability across raters. These differences were largely due to image limitations, particularly when faces were not visible or when the images consisted of anatomical illustrations. These findings highlight the importance of image clarity and context in visual research and support the continued use of multiple reviewers in future studies to reduce bias and improve accuracy. Ultimately, establishing strong inter-rater reliability strengthens the credibility of our findings and contributes to the overall rigor of the research process. Our analysis revealed a clear overrepresentation of white adults without observable disabilities, most of who were depicted in non-provider roles across all 4 occupational therapy textbooks. This portrayal does not reflect the diverse populations that occupational therapists work with in real-world practice. These findings are consistent with previous studies in medicine, nursing, and allied health, which also represent limited representation of BIPOC individuals and people with disabilities in educational materials. We also found that females were represented more often than males, which may reflect the gender demographics of the profession. However, most individuals were still shown as non-providers, which could contribute to the narrow or inaccurate perceptions of occupational therapist roles. Perhaps most concerning is that nearly 80% of individuals depicted had no observable disability, even though disability is the central focus of OT practice and affects 1 in 4 U.S. adults. This lack of representation raises questions about how well students are being prepared to work with individuals of varied abilities, including those with invisible disabilities. Altogether, these findings emphasize the urgent need for OT educational materials to better reflect the diversity of both clients and providers. Without more inclusive visuals, students may lack the foundational exposure needed to develop cultural competence and provide equitable care.
While our study offers valuable insights, there are several limitations to consider that may have impacted our findings. One limitation is the reliance on visual interpretation to determine demographic characteristics such as race, gender, and disability status. Although we use a structured coding system, identity is complex and not always visually apparent. For example, individuals with non-visible disabilities or non-binary gender identities may not have been recognized in our analysis, leading to potential undercountings. Another limitation involves image clarity and context. Some images lacked facial visibility or only included partial body shots, making it difficult to determine demographic characteristics with confidence. While we labeled these as undetermined, this ambiguity affected roughly a quarter of the images. Additionally, although our final inter-rater reliability was strong, initial analysis involves single rater coding, which may introduce some subjectivity even with standardized criteria. In terms of scope, our study was limited to 4 textbooks, 4 of which are widely referenced in the NBC-OT exam. While this is highly reflective of the OT education, it doesn't encompass all OT educational materials. Additionally, we didn't analyze case studies or author perspectives or terminologies. Despite these limitations, the conclusions we drew remain significant. Our results reveal a clear pattern. Occupational therapy textbooks overwhelmingly depict white, able-bodied adult individuals in non-provider roles. The underrepresentation of BIPOC disabled, older adult, and non-binary individuals raises concerns about the values being implicitly communicated to students through these texts. When learners don't see diverse identities reflected, it may impact their cultural competence, reinforce biases, and hinder their ability to deliver inclusive, equitable care. Looking ahead, there are several key directions for future research. First, we recommend expanding the scope of analysis to include not only visual content, but also written content such as narratives, learning objectives, and case studies to determine if similar patterns of underrepresentation persist. Second, it would be valuable to examine the impact of textbook content on students themselves. Future studies can investigate how exposure to diverse or non-diverse educational materials affects student perceptions, confidence, or readiness to engage with clients from varied backgrounds. We also suggest analyzing a larger and more varied selection of textbooks to paint a more comprehensive picture of demographic representations across OT education. In addition, conducting a power analysis could identify where certain demographics are represented, whether some groups appear more frequently in specific chapters or content areas to see the patterns within the textbooks. It would be informative to compare older and updated versions of textbooks to assess whether and how representation has evolved over time. These next steps are crucial for ensuring that occupational therapy continues to grow as a socially responsive, client-centered profession. We'd like to thank Dr. Nuwere and Dr. Isinger for their continued guidance and support, and for making our research possible. Thank you.
That was wonderful, occupational therapy.